West Nile virus, or West Nile, can be a dangerous, life-altering, and even fatal disease, and should therefore be considered a potentially serious virus.
West Nile is part of the Japanese encephalitis antigenic complex of viruses. It is currently found in both tropical and temperate regions. West Nile mainly infects birds, but is also known to have infected horses, dogs, cats, chipmunks, rabbits, and humans.
This documentary contains important information that can help you recognize and prevent West Nile. Following the simple steps outlined in this presentation will provide added protection for you and those around you.
The main route of human infection is through the bite of an infected mosquito. Mosquitoes become infected when they feed on infected birds.
In the majority of West Nile cases, there are a few symptoms. Approximately 80% of all people who are infected with West Nile will show no symptoms at all. However, up to 20% of those who become infected will display milder symptoms that develop between 3 and 14 days after they are bitten by the infected mosquito, including
high fever, body aches, nausea, vomiting, swollen lymph nodes, a skin rash on your neck, stomach, and back, and headache. Milder West Nile illness will improve on its own. People do not need to seek medical attention, although they may choose to do so. Symptoms sometimes last for as little as a few days. However, many healthy people have become sick for several weeks.
More serious symptoms do occur in a few people. About 1 in 150 people infected with West Nile will develop a severe illness. Severe symptoms of West Nile can include
unusually strong headaches, neck stiffness, stupor, disorientation, tremors, convulsions, muscle weakness, vision loss, numbness, paralysis, and even coma. These more serious symptoms may last several weeks, and the neurological effects can be permanent.
You should seek medical attention immediately if you think you have been infected with a severe case of West Nile.
It will usually require hospitalization. While the most common transmission of West Nile is through an infected mosquito, in a very small number of cases, West Nile has also been spread through blood transfusions, organ transplants, breastfeeding, and even during pregnancy from mother to baby. West Nile, however, is not spread through casual contact such as touching or kissing a person with the virus.
Talk with your healthcare provider if you have any questions or concerns.
It is also important to note that people over the age of 50 are generally at a higher risk of getting seriously ill and more likely to develop serious symptoms of West Nile if they do get infected. They should take special care to avoid mosquito bites.
In fact, the easiest and best way for anyone to avoid West Nile is to prevent mosquito bites.
Mosquitoes are most active at dusk and dawn. If you are going to be outdoors, use insect repellent containing an EPA-registered active ingredient, and always follow directions on the package. Wear long sleeves and pants at this time, or better yet, consider staying indoors during these hours. Experts believe West Nile is established as a seasonal epidemic in North America that flares up in the summer and continues into the fall.
Currently, there is no specific treatment for West Nile. The CDC is working with state and local health departments, the Food and Drug Administration, and other government agencies, as well as private industry, to prepare for and prevent new cases of West Nile. Some things that health agencies are currently doing include
coordinating a nationwide electronic database where states share information about West Nile, helping states develop and carry out improved mosquito prevention and control programs, developing better, faster tests to detect and diagnose West Nile, creating new education tools and programs for the media, public, and health professionals, opening new testing laboratories for West Nile virus, and working with partners on the development of vaccines.
Following the guidelines provided by local health agencies and the CDC ensures a safer and healthier environment for everyone involved. You can listen for news from your local health department regarding additional West Nile infections and watch for updates on this website.